Okay, ready.
Come in.
Hello, my name is Lance. I'm a level 1 student nurse, and I've been assigned to kind of shadow you. Is that okay?
That's fine. Let me ask the patient though.
Okay.
Mr. Jarvis, I have a student nurse with me. He wants to shadow me as I administer medication. Would that be okay?
Yes, yes.
Okay,
go ahead.
fantastic. I'm going to give a report on the patient. His name is Ronald Jarvis.
Is that an S-bar report?
Yes, it's my report. That's how we do it.
Okay.
His name is Ronald Jarvis. He's in room 622. He's 67 years old. He has no known allergies. His attending doctor is Dr. Phillips, and he's a full code patient. He was admitted to the hospital with his primary diagnosis being a diabetic ulcer on his right heel. It has not been healing. It's been apparent that he had it for 3 weeks, and he came into his doctor's office, and his doctor sent him over here to get further treatment. He is a type 1 diabetic. He is insulin dependent. He has a pain level of 1 at the moment. At 1600 we administered a narcotic. He's alert and oriented ×4. He has no CNS problems. He has a Glasgow scale of 15. He's able to obey motor commands. He's not limited to mobility, and he's oriented and he converses, and he's prola. His breath sounds are even and effortless. He has no cough, and he's on room air. His heart sound, his apical is regular. He has no murmur. S1 and S2 present. Radial pulse is a 2+, and capillary refill is less than 3 seconds. His abdomen is flat. Bowel sounds are apparent in all 4 quadrants. He's on a diabetic 1800 calorie diet with sodium limitations of 2 grams per day, and he's continent to a bowel and bladder. He does have an IV in his right median vein. It's a peripheral line. It's 20 gauge. His labs are his sodium is 141, potassium 3.8, chloride is 104. His BUN was 19. His creatinine was 1. His fasting glucose was 310. Hemoglobin 14.5. Hematocrit 41.2. Platelet count 172,000. And his calcium is low. It's 7.4. So we're gonna watch out for. We want to monitor him for hypocalcemic signs like deep tendon reflexes, like Tresailles signs, things like that. His last vital signs were at 1645, heart rate was 76, O2 sat was 96, BP was 128/70. He does have some medicine scheduled right now, insulin, but on a daily basis he takes Lantus, Glargine, which is a long-acting insulin, Zocor, Zeroxin 2-3 times a day, insulin regular, QID, and he has morphine PRN order every 4 hours for his pain dealing with the ulcer. Right now we work on interventions of pain control, keeping his pain under control. We're monitoring for signs of hypoglycemia once we administer his insulin. We monitor his wound. He has a wound care consult tomorrow with a wound care nurse, and the doctor's ordered vital signs every 8 hours.
Do you mind if I ask you a few questions?
Sure, go ahead.
Why is this client receiving this med?
Okay, right now he's scheduled to take Glargine, which is a long-acting insulin, and regular insulin. Now, regular insulin, and insulin is given to the patient in order to keep their blood glucose in within normal limits, which is between 70 and 110. Right now, his insulin is 242, so we want to give him something to bring that down.
Okay. What action does that medication have on the body?
Okay, insulin allows the body to taking the glucose into the skeletal muscle and the fat, and also the Lantus, I know, inhibits the production of glucose in the liver.
When should you question administering this medication?
You should question the administrator's medication when the glucose is too low, because that can lead the patient to get into hypoglycemia, which is dangerous. And also, if the patient's allergic to medication, it can cause adverse reactions to the patient.
Well, that makes sense. What vital signs should you monitor?
We're going to be monitoring his respirations first, because that's important in case he's in any form of compensation. His blood pressure, I said respirations, heart rate, and temperature.
Oh, cool. What physiological parameters should be monitored when the medication is being administered?
Physiologically, we need to monitor for, tingling in the arms and legs, because this would indicate, tingling in the arms and legs, or chills, because this would indicate that the patient is in a hypoglycemic state. So we want to monitor for those things.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, in a hospital setting, the patient has to be aware of, the 5 rights, right? Make sure that we're giving the patient the medication to the right patient, make sure it's the right dose, the right route, the right time of administering. So the patient needs to be aware of all of these things.
Okay. What interventions must be taught for taking the med safely at home?
Well, the patient needs to be taught the same things about the right dose and how to, with regular insulin, sometimes it goes by sliding scale, so the patients understand that sliding scale. Also, the patient needs to understand when you're administering the medication, you can't always put the same spot. You need to rotate the spots and make sure you use alcohol pads, make sure it's clean, and things like that.
Okay. Are there any side effects to this medication?
This medication is insulin, so the action is to bring the glucose down, and adversely it could bring the glucose too far down below take it down out of the parameters, normal parameters, so that could be dangerous for the patient.
What are adverse reactions?
Adverse reactions could be hypoglycemic shock, where they would have experienced chills, tingling. It could also lead them to a decrease in mental status.
Okay. How do you know if the medication's been effective?
Once the blood glucose returns to normal parameters, which would be 7110, I would say the medication has worked. So that's our goal, to bring the glucose down to normal.
Okay, thanks.
Range. Okay.
Very, very informative, Rhonda.
Thank you. Okay, now we're going to administer the medication to the patient. Okay. My hair is hanging down, so I'm going to take a moment and put my hair up, so you don't want that hanging on the patient. I'm going to wash my hands. Good evening, Mr. Jarvis.
Good evening. How are you?
Good evening again. We keep bugging you, don't we?
Okay.
All right, my dear. We're gonna administer your medication for you. We're gonna start off with your regular insulin. Do you take this at home?
Yes, I do.
Okay. Do you know how you administer it properly at home?
Yes.
Do you know about rotating your sites and such things like that?
Yeah, I was told that before.
Oh, okay, great. Okay, I'm just gonna bring some stuff up on the computer, then I'm gonna start working. Do you have any allergies, Mr. Jarvis?
No, I don't.
Okay. Okay. Just bringing some stuff up on the computer. It's running a little slow. So here we've got 2 meds ordered. We've got your insulin, Glargine, your Lantus, that's your long-acting insulin. And we've got your regular insulin that you get 4 times a day. We have that ordered. I'm going to give you your regular insulin first, okay?
Okay.
Now, I checked your blood sugar, and it was 242.
Oh, okay.
So according to what we have here on a sliding scale, we've got to give you 16 units, all right?
Okay.
16 units, okay? So that's 16 units of insulin. Subcutaneously, 2,100 hours. And okay, we're right within the time limit right now. Okay, I'm gonna wash my hands again. Can you tell me your name and date of birth, or date of or age, please?
Oh, is Harvest Ronald 67.
Okay. I'm just gonna scan your badge here, your band here. Wait, 1 second, I think I did. I'm gonna check this one more time. Can you get your name and age for me one more time?
Yes, Harvest Ronald and 67 years old.
Okay. Give you your regular insulin. And this is your regular insulin. Expiration date is in 2020, 6/2020, so that's good. I'm gonna give it to you. Insulin, you have no allergies. Regular insulin, subcutaneous. That's right route. Dose is 16 units because it's your blood sugar is 242. Time is 21. I got the right patient, okay. Alright. I'm gonna draw up the insulin for you, alright?
Okay.
Draw in.
So that's all without the
I want to check this one more time. So we've got. Can you tell me your name and age again for me, please?
Yeah, Ronald Harvest 67.
Okay. And this is regular insulin. Sub-Q. Route sub-Q. Dosage 16 units because you have 242 blood glucose. Right time. Okay. Alrighty. Okay. Where would you like? Do you have any specific place you want your insulin administered today, Mr. Jarvis? You can have it in your abdomen or on your arm.
My abdomen. Will
Abdomen,
be fine.
okay.
Mhm.
Alright. Try a little bit. Okay.
Oh, that's right.
Alright. I'll take my gloves off and I'm going to document that, okay? Mr. Jarvis, do you understand the side effects or the how hypoglycemia shows up? Do you understand if you have chills in your arms and legs, or tingling in your mouth, or you feeling chills? Do you put your call light on right away, okay?
Okay, I
We'll
will.
come in here and check on you.
Okay.
Just documenting the time I took it. 36. Do you feel any burning or anything in the site that was just, so I just administered the insulin?
No, I'm fine.
Alrighty, fantastic. I just documented something here, Mr. Jarvis. Hmm? Okay. All right. Mr. Jarvis, I gotta have one more medication. We're gonna do your long-lasting insulin. Okay, this is gonna last. Start showing its effects around 3 hours after I administer it. Okay,
Okay.
and this should work over a 24-hour period. Grab some gloves here. Mr. Jarvis, can you tell me your name and age again for me, please?
Again? Okay. It's Ronda Harvest 67.
Okay, thank you very much. Okay, so you have 18 units of Lantus ordered. Supposed to be administered subcutaneously daily at bedtime. Okay. units of this. I bent the needle there, Mr. Jarvis. I need to get a new needle. Still doing the 18 units. Want to check this one more time. We've got insulin, glargine, which is your long-acting insulin, 18 units, sub-Q administration, daily at bedtime. And your name again?
Oh, Ronald Harvest, 67.
Okay, great. And do you have any allergies?
No, I don't.
Alrighty. Where would you like the administered?
On my arm.
Your arm? Okay, great. You need a lower arm. Okay. I'm gonna clean off with some alcohol here. Let it dry a little bit. Feel any burning or irritation where I just administered that insulin, Mr. Jarvis?
No, I don't.
Okay. All right, let me just do some documentation here.
Okay.
Okay, your meds are all administered. I know earlier, Mr. Jarvis, your chart said you wanted some information about the diabetic diet. I printed out some pamphlets for you to read. And I'll give them to you so you can go over them. And if you have any questions at all, you can just ring for me. And you know about how carbohydrates affect your blood glucose more than any other food and things like that. If you have any more questions, you just bring your call out, okay? All right, thank you, Mr. Jarvis. Okay.
Can I ask a couple more questions?
Sure.
Was there any pertinent pieces of information you reviewed before administering this med?
Yes, I reviewed his blood glucose because that's very important before administering the medication. We need to know what their blood glucose level is. If it's too low and we administer it, it could drop his blood glucose even lower, causing a hypoglycemic reaction.
So this information affected your decision to administer the med?
It definitely did. Because if it was too low, I could not have given it. Yes.
Did this information affect how you administered the medication?
Well, when it comes to the regular insulin, the amount I administered depends on how high the glucose level is. Like today it was 242, so I had to give 16 units, which is up from.
Okay.
Yeah, that's the amount I would give with the parameters change according to what the glucose level is.
Okay. Thank you, Rhonda, for letting me take part in this.
Okay, thank you so much.
Have a great day.
You too.